Welcome to the Teaching You to Fish podcast, financial literacy for the rest of us. My name is Carl Fish, and I'm the host of this podcast. This is episode 16, Health Insurance in Retirement. In our last episode, we talked about spending needs and cash flow in retirement. One of the major expenses in retirement is paying for health insurance, as well as healthcare costs in general start to increase. Most people are generally aware that when they are employed, their employer, typically, pays for a large portion of their health insurance. And they are also aware that that will likely stop once they retire. But most people also haven't really internalized how much their employer has been paying for their health insurance, and that, when you add that to the portion of the premiums you've been paying, it's a really significant expense in retirement. As a retiree, you typically no longer have access to the group plan through your employer, so you don't get the advantage of a group plan rate that is often effectively discounted for you as an older person, because you're grouped with a much wider population that often includes people who are less costly to insure. You now will also have to figure out where to buy health insurance, and the rate will be based on people in your age cohort. There are two distinct health insurance eras in retirement: before you turn 65 and after 65. And the information you need to know and the decisions you need to make are different in each era. This is because beginning at age 65, typically, there can be exceptions if you're still employed, you are covered by Medicare, and the total cost of your health insurance and care typically decreases significantly. Prior to age 65, however, you have to find other options, and the options that are available to you vary tremendously based on factors including your previous employment and whether you're married or not. So let's take a look at some of those pre-Medicare options, and then we'll discuss Medicare later in the episode. The first option that everyone has, as long as you had health insurance via your last employer, is COBRA. COBRA stands for the Consolidated Omnibus Budget Reconciliation Act, which gives workers and their families the ability to choose to continue group health benefits provided by their employer plan after they leave that employer, typically for up to 18 months, although there are exceptions. Unfortunately, you usually have to pay the full premium, including what your employer previously paid, and sometimes even have to pay up to 2% more for administrative expenses. But it can be a great option if you really like your current health insurance coverage, and it can serve as a bridge to Medicare if you're close to age 65. Another option, although it's increasingly rare, is that your employer may offer you subsidized health insurance coverage in retirement. Some employers allow employees to stay on their health insurance plans in retirement, and they pick up some of the cost, sometimes the same amount as when they were employed, sometimes a lower amount. For folks in public service, there are often, but not always, options through your pension plan and/or the state, where you have access to group plans that are often at least partially subsidized. If you are married and your spouse is still employed, many times you can get added on to your spouse's coverage through their employment, at least until they retire. And everyone, at least as of the time of this recording, who doesn't have any of those options has access to coverage through the health insurance marketplace provided for by the Affordable Care Act. So, how do you choose? The process is very similar to choosing health insurance through your employer if your employer offers multiple options. You want to compare network coverage, which doctors and hospitals are covered, deductibles, co-pays, co-insurance percentages, out-of-pocket maximums, and of course, the premiums you'll pay. Generally, COBRA will be the most expensive option, so not many folks will want to choose that unless they have a short period of time until they start Medicare. If your employer, pension plan, or the state offers you subsidized coverage, that is often a great choice. But it depends on the coverage and how much it is subsidized. If your spouse is still working, that can also be a great option, but depending on their employer, it might be very expensive. Which brings us to the health insurance marketplace, which offers coverage under the Affordable Care Act. Coverage under the ACA can be complicated, so this will not be a comprehensive look at it. But the basics for most people are pretty easy to understand and are worth talking about briefly. Under the ACA, you cannot be denied health insurance coverage based on a pre-existing condition, and your premiums are not based on your health history or condition at all. Instead, they are based on what marketplace plans are offered in your state, your current age, and if you're getting individual or family coverage. In most, but not all, states, You have a choice of many plans from many different insurance companies to choose from. These plans are typically identified as gold, silver, or bronze plans, with gold having the most coverage, but also typically the highest premium, and bronze having less coverage, but lower premiums. You also typically have choices that include PPOs, DHMOs, and high deductible health plans, some of which are HSA qualified high deductible health plans. One of the key features of ACA plans are the subsidies, in addition to the guaranteed coverage. As you are likely aware, the current administration has expressed a desire to radically change or eliminate the ACA itself. So the following discusses what the subsidies look like in May of 2025. If you're watching this after 2025, this information will likely have changed. When the ACA first passed, subsidies were provided for anyone with a modified adjusted gross income up to 400% of that year's poverty level, based on your family size. The American Rescue Plan in 2021 and then the Inflation Reduction Act in 2022 modified and enhanced those subsidies, increasing the subsidies for lower incomes and removing the 400% of poverty level cap. The enhanced subsidies are currently scheduled to expire at the end of 2025. Barring further legislation from the new administration, the subsidies will return to their previous levels. These charts show the federal poverty guidelines for 2024 for coverages in the year 2025 and the subsidy percentage for 2025. So, as an example, if you are single, household size 1, and your modified adjusted gross income, MAGI, was $37,650, your premiums would be capped at 4% of your gross income, or $1,506 a year, $125 a month. If instead your MAGI was over $60,240, your premiums are capped at 8.5% of your income. So, for example, if your MAGI was $62,000, your premiums would be capped at 8.5% of that, or $5,270 per year, $439 per month. For folks with really high incomes, the 8.5% subsidy becomes moot because the 8.5% cap is higher than the unsubsidized premiums for the policy. You have to look at the combination of household size and income to figure out your percentage cap for your premiums. Note that not everyone qualifies for the ACA subsidies. For example, if the coverage you can get through your spouse's employer is considered affordable, a definition we won't explore, then you would not be eligible for the subsidies, although you could still choose to pay full price through the marketplace. In 2026, barring new legislation, and new legislation is likely, the subsidies will return to the levels shown in this chart. Whether the ACA is going to be the best option for you will depend a lot on your other options, your income, and the subsidy percentages in any given year. As an example, this linked blog post discusses my current health insurance choices. Right now, with the enhanced ACA subsidies, getting coverage through the ACA is our best choice. If the enhanced subsidies go away next year, which they are scheduled to unless there's new legislation, then we will no longer qualify for a subsidy, and our best option will be the health insurance options available through our pension plan. To give you an idea of the magnitude of the costs you're looking at, coverage for my wife and I is currently $832 a month with ACA subsidies, but would be $1,462 a month through our pension plan, and that is also partially subsidized by the pension plan. The cost if we didn't have the pension plan as an option and were not eligible for the ACA subsidies would be $1,553 per month, which is over $18,000 a year. And this is for a bronze plan. If the enhanced subsidies are repealed, it will be like an $8,600 tax hike for us next year, as the subsidies are a tax credit. These are the expenses that I mentioned earlier that people know they're going to have, but often have not really thought about their magnitude. And note, this doesn't include dental or vision insurance, if you want those as well. As discussed in episode 6, for many people, an HSA qualified HDHP can be a great choice because of the opportunities an HSA provides you. You are allowed to continue contributing to an HSA until you are on Medicare, typically age 65, but that's only if you have an HSA qualified HDHP. The plan we've chosen is, so we are directly contributing the maximum to each of our HSAs each year and continuing to invest the money and let it grow. We will likely start drawing down our HSA sometime between the age of 65 and 70. So for us, This is another part of retirement cash flow. You can even use HSA funds to pay your Medicare premiums. Once you reach age 65, however, everything changes. This is because you are now eligible for Medicare. Note that if you are still employed, you can choose to remain on your employer's plan if they allow it until you retire, and then start Medicare. Again, this will not be a comprehensive look at Medicare, and I highly encourage you to look at the Medicare and You booklet and then explore even further. But here are the basics. Medicare is health insurance that covers everyone in the U.S. age 65 or older and is part of our social safety net. You pay a monthly premium for Medicare, deducted from your Social Security payment if you receive one. Otherwise, you pay directly. In 2025, most people pay $185 a month for Medicare, but those with higher incomes pay a surcharge referred to as IRMA, Income-Related Monthly Adjustment Amount. What some folks don't realize, however, is that most people also choose to purchase a supplemental plan in addition to Medicare, because Medicare does not cover everything. Medicare itself has both a Part A and a Part B, which covers hospital insurance and medical insurance, respectively. You can use any doctor or hospital that takes Medicare anywhere in the U.S., but typically have to pay 20% coinsurance. There is no yearly maximum out-of-pocket cost, and it doesn't cover prescription drugs, which is why most people choose to get a supplemental plan. The types of supplemental plans you can purchase come in two flavors, Medigap and Medicare Advantage. The differences between these types of plans are both complicated and nuanced, but here are the basics. Medigap policies are standardized by the government. Insurance companies all sell the same types of plans that have to offer the same standard benefits, but then can customize on top of those. Medigap plans generally have less hassle than Medicare Advantage plans in terms of getting approval for care because there are no prior authorizations. If Medicare covers it, Medigap almost always pays. These plans are unhelpfully named by letters of the alphabet, and some plans are no longer offered to new enrollees. At the time of this recording, plans A, B, C, D, F, G, K, L, M, and N are offered, all with different levels of coverage. Some of them cover some or all of your Part A and Part B deductibles, prescription drugs, skilled nursing facilities, and foreign travel emergencies. They are less likely than Medicare Advantage plans to cover things like dental and vision. The coverages vary dramatically between the different level plans, so you need to pick and choose carefully. And of course, the plans with more coverage do have higher premiums, although they are still quite reasonable compared to pre-Medicare health insurance costs. Your premium for each plan, this is in addition to the $185 a month premium for Medicare Part A and B, will vary based on your age, your state, and your insurance carrier, and you can explore those online. You are generally guaranteed acceptance to a Medigap policy at the standard premium amount during the open enrollment period, which lasts 6 months after you turn 65 or start Medicare. If you don't choose a Medigap policy within this window and later want to add it, you are not guaranteed acceptance. And even if you are accepted, your premium could be much higher than the standard premium because the insurance company is allowed to consider your health history. For this reason, along with less denial of care, many people choose to get Medigap when they turn 65 instead of a Medicare Advantage plan, and then stick with the Medigap plan. Medicare Advantage, often called Part C, is a newer alternative to Medigap policies. The policies cover prescription drugs and some of your Part A and B deductibles, and they often include additional extras that Medigap doesn't cover, like dental and vision insurance. But Medicare Advantage policies are not standardized, so the coverages vary much more widely than any of the Medigap letter plans. And the insurer can require referrals to specialists and reject payment for services they don't consider necessary or medically valid. Prior authorization. They also don't necessarily pay the same amount to doctors and hospitals as Medicare rates, which can limit your options and mean you have a more limited network of coverage. Meaning you can't always choose the doctor or hospital you want. While this sounds somewhat inferior to Medigap policies, and in some ways they are, many people choose them because these are the plans that are offered by some employers, pension plans, and states. If any of those provide you a subsidy, then that subsidy will only apply if you choose their Medicare Advantage plan instead of a Medigap plan. Some people also prefer Medicare Advantage because of the extras like dental and vision insurance, gym memberships, and similar offerings. And because sometimes it's easier to stick with your same doctor and network that you've been used to. I can't tell you which to pick because it depends on your individual circumstances and what you have available to you. In general, if you do not have access to any subsidized Medicare Advantage plans, then it's likely that Medigap is the better choice. On the other hand, if you have a subsidized Medicare Advantage plan, the plan coverages meet your needs, and the subsidy is pretty decent, that could be the better option. While Medicare in and of itself is a great thing, you will still want to do a bit of research to decide which flavor of supplemental policy you want, as well as which particular level of coverage. In addition to choosing health insurance, there are other factors related to your health that you need to carefully consider in retirement. Crucially, this includes where you live. There is much better access to healthcare in larger metropolitan areas than there is in rural areas. And even in metropolitan areas, you need to make sure that the health insurance you have chosen has available providers in your area. As we talked about in episode 7, don't forget about the possibility of needing long-term care. If you choose to live in a more rural area, you may not have many or any options for long-term care. And if you have a partner and one of you needs long-term care, the other one isn't going to want to have a very long drive to spend time with the other one. That doesn't mean you can't choose to live in a more rural area. It just means that you need to factor that into your decision making about both where to live and which supplemental Medicare policy to choose. Again, a reminder, Medicare does not cover long-term care insurance. If you are taking notes throughout this series, write a paragraph or two of reflection on this exercise. If you're comfortable sharing your reflection, there are several ways to do that. If you're watching or listening to this on Spotify or YouTube, then you can leave your thoughts and your feedback or questions in the comments. You can also always reach out to me directly on social media or via email. I'm Carl Fish on Blue Sky, Twitter, Facebook, and YouTube, or you can email me directly at carlfish@gmail.com. Let me reiterate, this was not intended to be a comprehensive look at health insurance and retirement. Instead, it hopefully gave you the basic information that will allow you to make better decisions around your health insurance choices. In our next episode, we will discuss leaving a legacy, the documents you need, and the considerations and decisions you need to make in order to successfully conclude the life you want to live.